Hello friends, I'll be sharing some information about Nipah virus as an outbreak of Nipah virus infection is going on in our country for past 1 month. Coming to the current outbreak, this outbreak is mainly involving the respiratory system and brain of the patients, causing acute respiratory distress syndrome and encephalitis. The first two outbreaks were reported from West Bengal, from eastern state, while this is the first outbreak to be reported from Kerala. Till 20th May 2018, 15 people have been tested positive from two districts of Kerala. Those are Kozhikode and Malappuram, and 13 deaths have been reported. 3 from Malappuram, 10 from Kozhikode district. What steps our government is taking? The government has sent a national level team from National Center for Disease Control to Kerala to analyze the situation. Government is also involving many national level laboratories to confirm the cases, and our government is also coordinating with other sectors like private sectors, clinicians, wildlife, animal husbandry, etc. The Ministry of Health and Family Welfare has uploaded the information about the Nipah virus and the outbreak on its website. Now, the central high-level team has declared that this outbreak is limited only to 2 districts of Kerala, and it is a local outbreak, so there is no need to panic. This video will cover the importance of the outbreak. How is it so important for us to know about the infection, background, that is some previous outbreaks, and information about the virus, how it is being transmitted, what are the symptoms of Nipah virus infection, and how can it be controlled and prevented. Nipah virus is a zoonotic disease which mainly affects animals like bats, pigs, dogs, horses, etc. It is mainly prevalent in Southeast Asian region countries, and although very few outbreaks have been reported till date, but they were very fatal. The case fatality rate of the outbreaks were very high, even up to 100%. It was first discovered in Malaysia in 1998, and till date no other outbreak have been reported in Malaysia. The natural reservoir of Nipah virus is fruit bat of genus Pteropus, and it is found in South Asian region countries in abundance, and these fruit bats can cover huge distances, and there have been a huge habitat loss of bats. That's why the outbreak is occurring again and again. The first outbreak was reported in Malaysia in 1998, where 90% of the people were pig farmers or those people who had contact with pigs. Nipah virus infection in India was first recognized in the year 2001, and in the same year it was also recognized in Bangladesh. Then after that, another outbreak of Nipah virus occurred in 2007. Both the outbreaks were reported from West Bengal. This is the geographical distribution of fruit bats, and these red areas are representing the areas where Nipah virus outbreak has already occurred, while the orange areas are representing those countries which are at high risk of getting the outbreak. Now coming to the modes of transmission of Nipah virus, it can be transmitted from animals to humans, or even from human to human through contaminated foods or direct contact. The clinical presentation The disease can vary from asymptomatic to causing death, and otherwise the symptoms are flu like fever, headache, drowsiness, disorientation, mental confusion, coma. The laboratory diagnosis can be done by serology, detecting antibodies against the virus, or virus isolation, ELISA, serum utilization test, etc. Since India has already faced two outbreaks of Nipah virus, so there are facilities in our country to detect the disease. But in most other countries of Southeast Asian region, there are no adequate facilities for diagnosing the virus. Coming to the prevention and control, there is no specific treatment for the disease, even in animals or in humans. The treatment mainly involves supportive care, and it can the disease can be prevented by avoiding eating raw fruits and vegetables, or other fruits eaten by birds, animals. Healthcare workers who are taking care of the patients infected with Nipah virus must follow the standard precautions while handling the patients, and the infected persons and those who are expected or suspected to have the infection are kept in isolation, and personal protective measures like masks, gloves should be worn by the attendants of infected patients. So this was all about the Nipah virus. Thank you so much.